Navigating the health system is a confusing and complicated task. Healthcare is undergoing a revolution right now, one in which you have two ways to go. You can get lost in the expensive shuffle, or you can get better health care while saving a lot of money. My name is Newt Malerman. At one stage of my life, I had 9 doctors, none of whom could access my health records at any of the other practices. I learned a lot about the complicated medical establishment and wanted to use what I had discovered as a patient to help others get the safest possible care. I authored a book I wanted to call How to Get Out of the Hospital Alive. My editor vetoed the title. So the Prostate Health Workbook was born. The proactive, common-sense advice I gave in that book has been widely quoted and led to a second publication, the Hospital Survivors Workbook. Both books are available on Amazon. So let's clear the deck and take a hard look at this confusing picture and see if you and your family fit into it. Do you ski or box or play football or any other physical sport? If so, you should know about physical health records. Some occupations are overtly dangerous, like police and firemen. Other occupations are statistically almost as dangerous, like roofers and truckers. If you or a member of your family is in a risky business, that person should be carrying a personal health record, PHR. And if you or yours has any kind of health condition, like allergies or deafness or Alzheimer's disease, they are at risk. Indeed, having a personal health record just might save your life in an emergency. In addition to health problems, you never know when fate will step in and give you a tap on the shoulder. I have been hit twice by drivers who were on their cell phones. It's amazing to me that so many drivers text and drive, resulting in soaring accident rates. If you are in an accident requiring emergency medical attention, be sure to carry an inexpensive PHR. It's cheaper than an insurance policy. Just who are the providers in our complicated health system? Well, your family doctor, of course, and any specialists you need, and clinics and hospitals, and all the testing facilities you may go to, each of which requires the same health information. And you'd better be accurate, because changing a letter or two in a prescription might land you in very hot water. Very much in the picture are the folks who control what you pay for your medical care. By taking proactive control of your health issues, you can lower unnecessary costs, eliminate unneeded procedures, avoid contraindicated prescriptions, and save loads of time. So how do you get a PHR and where do you keep it? There are free programs that will help you make a health history. Why shouldn't you use one? Well, these are not charitable organizations. They sell your demographics, making huge profits in the process. If you list with them that you are diabetic, for example, you will find your email and internet browsing filled with hundreds of ads for diabetic supplies. Some of that data is very personal, and you don't want an employer or a life insurance company to be able to access it. But an even worse problem is that these PHR companies store your private data in the cloud, not really up in the air somewhere, but in huge banks of server computers. If you do permit access to a medical practitioner, it will take time to go to the cloud, sign in, and access your records. In addition, and much more important, many cloud-based records have been breached by hackers. The loss of such health data has been estimated at over 80% of all such records. Thefts of health records now exceed those of bank and Social Security records. Here's an urgent message to AARP members that clearly explains the threat. You might want to pause this video to read the article. It could save you thousands of dollars and one heck of a lot of time, money, and effort. Is there an alternate to putting a PHR in a cloud? The only system I know of is our solution called PHR-Rescue. 3 years in the making, PHR-Rescue is housed on a 1/2 ounce flash drive. You control who sees your records, and since they are stored offline, they are virtually impervious to theft. In addition, our program strips out all sensitive data, like your last name and social security number. So even if you lose your rescue drive, there is no information on it that would make your information salable. PHR Rescue only retains data that is needed to save your life. On our website are links for patients, doctors, hospitals, and insurers. Clicking on those links expose unexpected benefits of PHR Rescue. As an example, let's take a look at the benefits for just one hard-working group that could really use some help. Caregivers are the unsung heroes of the healthcare industry. Many patients under their care are unable to remember the details of their health history. So carrying their details safely on a rescue drive is a relief for both the patient and the caregiver. They can both rest easy knowing that vital data is accurate even when the caregivers are not in attendance. PHR Rescue will make you and your loved ones safer in an emergency, improve the accuracy of their treatment, and save money for the patient and for the practitioner alike. Visit us at phr-rescue.com to learn more. And please, join us in this crusade and help us to revolutionize healthcare. The gifts we offer for your support will provide a substantial discount to an outright purchase. We sincerely thank you for your support of this innovative and vital program.